What is stress urinary incontinence? A urethral sling is used to treat stress urinary incontinence, or SUI, in women. The urethra is shorter in women than men, which causes women to have a higher risk of involuntary urine loss. SUI can be triggered by coughing, laughing, or sneezing, or during certain physical activities such as walking, running, or exercising. Pregnancy, childbirth, and aging can also contribute to SUI. Kegel, or pelvic floor strengthening exercises and physical therapy, can aid in reducing SUI, but sometimes a surgical procedure called a urethral sling is required. Procedure. The urethral or bladder sling procedure is an outpatient vaginal procedure that lasts about 15 to 30 minutes and is most commonly performed using general anesthesia. During the sling procedure, your surgeon will make one vaginal incision and two small thigh incisions. Strips of synthetic mesh, cadaveric tissue, or other biological material will then be inserted to create a sling or hammock under your urethra or bladder neck. The bladder neck is the area of thickened muscle where the bladder connects to the urethra, the tube that carries urine from the bladder. The purpose of the procedure is to help reduce accidental leakage by lifting the urethra back into a normal position. The sling also exerts pressure on the urethra in order to aid in urine control. Risks and complications. Like any surgery, although unlikely, risks and complications may occur. After the sling procedure, you may experience difficulty urinating or emptying your bladder completely. You may develop an overactive bladder, which can cause temporary urge incontinence. Some women may get a urinary tract infection or find intercourse to be painful or difficult. These symptoms usually go away after you've fully recovered. Be sure to call your physician if you start running a fever or have drainage from the incision site. If synthetic mesh is used, there is a small risk, less than 5%, that the mesh will erode through the vaginal wall, causing infection or long-term pain. Additional surgery may be required to fix these problems. Another risk is possible injury to the bladder or other pelvic organs by the instruments used to place the sling. However, these injuries usually do not lead to long-term complications. Prepping for the surgery. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you must arrange for transportation after the procedure. As an added precaution, you will be given an antibiotic the day of your surgery to reduce any chance of infection. Post-op and results. After the procedure, you will spend a short amount of time in the recovery room. You will need to have someone drive you home afterwards, so be sure to make arrangements for transportation. A small percentage of women may have to go home with a catheter due to voiding difficulties, but this is rare. Avoid anything that puts stress on the surgical area, such as excessive straining, strenuous exercise, or heavy lifting for about a month. Avoid any sexual activity for about a month or until you are cleared by your physicians. The good news is that nearly 90% of women experience significant improvement for 10 to 15 years after surgery. For many women, urethra sling surgery is a very effective therapy for the correction of urinary leakage. Your urologist and clinical staff will answer any of your questions and provide additional information to help you decide if this procedure is appropriate for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.